So I am glad to welcome Chander. She is a director professor of dermatology and a member of medical education unit UCMS and GTB hospital. She will be taking you through the session on how to write the title of your thesis. Some important tips and pointers will be given to you. So over to you, Dr. Chander, please.
Thank you, Dr. Amir. I'm trying to share my slides. Is my screen visible? Is
Yes,
is my screen? Yeah. Okay.
Yes, it is visible. You can make it full screen. Yeah. Thank
you. Thank you so much, Dr. Amir. Good evening, all of you. For the past 2 days, you have been going through various aspects of writing your protocol, which you are supposed to be submitting by 31st August this year. The various aspects that have been discussed with you right from the beginning has been framing the research question. Then you have been taken through reviewing the literature related to your research question. Thereafter, framing your aims, objectives, introduction, review of literature, methodology, and then going on to appropriate study design. Once after you have done all this, we want to move to framing the title. So it may seem that title is the first thing in your protocol. So you start with the title, but you certainly don't start with the title because this is entirely dependent on what you are going to do in your research work. So the main question has been your research question. The main thing which you need to set up is your research question, which was the first session. And by doing review of literature, you are able to, let's say, make the question more and more clear to you as well as to others around you. Now, once we have done, we have framed, we have chosen the study design, we have done the review, we have written down the introduction aspect and decided how we will proceed with our study. Now is the time to finalize the title. So through this session, we aim that you should be able to understand the importance of framing an appropriate title, identify the essential components that you need to include in this title, and also at the same time identify what could be the desirable components and the non-desirable components in a title to make it look very concise and very readable. The goal being to be able to frame a concise, informative, searchable title which conveys the contents of your study. So all the words here are important. It has to be concise, that is in as few words as possible. It should convey what your study is going to do. It should give the information to the reader right from, because you frame it later, but this is the first thing about your thesis that anybody else is going to read. Your protocol committee members, then the other people in your department, then once you have done your thesis, anybody who picks up your thesis is going to know your thesis through this title. So it should be informative as to what is contained in that particular thing. Then it should be searchable. It should come up whenever a person tries to search the same thing. So there is the importance of including the important words or the keywords in the title so that anybody can search and they will land up with your study. And it should holistically convey the contents of your study. So how do we do that is something which you are going to do in the next 20 minutes or so. So many of us might believe that what's there in the name, that which we call a rose by any other name, would smell as sweet. But in today's era of everything being searchable on the internet and every information being available at the click of a button, if you have the right words, of course you can't include hashtags in your title, but if you have the right words, then it is possible and you can predict that your study will be able to be, others will be able to search what you have been able to do, and it will convey the meaning to other people. So why is the title important? Because it absolutely makes the first impression. The first thing that anybody is going to read about your thesis is the title. So right from the beginning, it should be taught, it should be very scientific, and it should not convey any laxity, and it should convey exactly what you're trying to do. You will never get a second chance to make a first impression. So your first stroke on your thesis should be right. Though we know that this is not our first stroke, but it certainly gives us the first impression. When it comes to your protocol, or it comes to your thesis, or it comes to your paper after you have completed your thesis, most of the people are just going to refer to the title. Some will land down to the summary if they find the title interesting. And very few will read the whole protocol or the whole thesis or the whole paper. And we can't complain, because this is precisely all of us. We do this same thing only. When we are searching the literature for anything, the first thing that we read is the title. If we find the title interesting and the title conveys to us that it is going to give us the results what we are searching for, we are going to read the abstract or the summary. And if the summary gives us something of value, only then we are going to invest our time in downloading that paper and reading it in totality. Otherwise, we just move ahead. The title should convey your work at a glance. That is how science advances, because we need to be very specific and very proper in this aspect of our work. It reflects the summary of your work. That is what people are most interested in, the main ideas as to what you are looking for and how you are going to look for it. And it should reflect the scientific credibility. So there is no place for relatively non-scientific terms in the title. We do not create any sensation by the title. We do not ask questions in the title. We do not declare statements in the title, especially when we are doing a protocol, because this is a genuine research that we are going to do. So nowhere do we convey that we already have the answer, or it's a big sensational question that we are trying to make. And the title overall is going to determine your indexing. The keywords that is why they are important. You have done the session on reviewing the literature, and you all know that mesh words are something that you're going to look for when you're going to look for research pertaining to the topic that you want to work on. So your protocol, your thesis, it is all going to be indexed in the respective libraries, be it online or offline, based on the title that you choose for your work. So just to summarize, the title makes the first impression, conveying your work at a glance and reflecting its summary, reflects the scientific credibility of the work that you're going to do, and is used for indexing purposes thereafter, once you're done with your work. So what should the title then contain? There are many no-nos which we have talked about. What are the essential elements of the title? The essential elements of a title are the same essential elements which we have been talking to you from research question onwards. Because on these 4 pillars of 4 essential elements, you are basically going to build up your research right from the research question onwards to review of literature, to framing the title, and then conducting your work. So first of all is your population, or the patient, or the problem. These are known as the PICO elements. The population, the intervention that you're going to do. Yesterday, Dr. Amir was talking about, Dr. Dheeraj was talking about the intervention. So whether it's an intervention or an observation, here we are using the word intervention only. Encompasses the whole thing, that what you're going to do in that work. The condition or the comparison that you are going to do, the condition that you are going to work upon, or the comparator which is present, and what outcome you expect. So your title should convey the PICO elements, and these PICO elements, your whole review of literature and your methodology revolves around these 4 PICO elements only. The desirable elements which you could include in your title, which will make it appear more concise and sharp, include that it should be concise, maximum 15 to 20 words. We had a discussion that there are many very long titles also which are acceptable for protocol or for thesis, and that happens. It depends entirely on the work that you are doing and your departmental milieu, what you decide to do. Excuse me. However, keeping our title concise is a strategy which pays, because human attention span is limited. So if you're going to keep it in limited number of words, if you're going to convey your idea, your 4 elements in limited number of words, then that is the best thing to do. I'm very sorry for this. The title should be specific. It is always better to include the type of study, that is the study design that you're going to follow in your title, because from there onwards, many questions are already answered. The questions which your protocol committee is going to ask you, or the questions which the readers have in their mind, might be already answered if you include the type of study right in the title, and it differentiates your work from the work of so many other people. Geographical details like a study from Delhi or a study from India, these should be included in the title only if it is relevant to the work being carried out. For example, you are expecting some differences in Delhi, or you're expecting some differences in the Indian population with respect to the disease that you're going to work on, then you should definitely include the geographical details in your title. And please place the important words like your disease or your population right in the beginning, because as I said, human attention span is limited, and because of that, keeping it concise and keeping the keywords at the beginning helps convey your message in a much better manner. So, appropriate use of the colon helps you combine 2 sentences into one single sentence of the title. So this colon, if it is appropriately placed, you actually are able to overcome many undesirable words in between, and you're able to make the title concise. We'll be seeing through a few examples. Then we come to the avoidable elements highlighted in red. What you should avoid, especially in a protocol title. Cut out the unnecessary words and phrases. So what we normally do is when we frame a title, and you think that this word may be unnecessary, the good filter is to just remove that word and read the title again. If it still conveys the same meaning, then it is better to remove that word to make the title concise. You should avoid declarative and interrogative titles, as I said earlier also, because there is no point in declaring the results in the beginning. Then why are you doing this research? And there is no point in sensationalizing your work by using interrogative titles. Abbreviations and acronyms should preferably be avoided in the title, because not everybody is going to be familiar with the acronyms which are your subject specific. So it's better to avoid them in the title. There are only one case when they are, you can use them if the acronym itself is better known than the full form. For example, HIV may be used because everybody understands what HIV is, irrespective of the specialty, and HIV makes the title more concise instead of the human immunodeficiency virus. So the title overall should be spiced, where the spice is the 4 elements that we initially talked about: the population, intervention, condition, and the end point or the outcome. Other than that, you can include the study geographic or otherwise, like it could be a hospital-based study, or it could be a study in East Delhi population or something like that. And the design, whether it's a cross-sectional study or analytical study or interventional study, these things, when you make your title spiced, the flavor is really good. So just to summarize some examples. If there are any questions, then please let me know in the chat box. Through these examples, we are basically trying to identify the essential elements, the desirable elements, the avoidable elements, and the missing elements in the title. And all of these are examples of published original studies. So this way we can actually see that how we can maybe frame a title, because there is no one correct way of framing a title. There can be many ways of saying that same thing, even within those limited 15 to 20 words. Many options are possible. The points that I've discussed today are basically just geared towards making it more scientific appearing, more logical, and conveying maximum information using the least number of words. For example, in this study, which factors predict the incident pressure ulcers in hospitalized patients? A prospective cohort study. So can somebody please tell me, is this title perfect? Or is there anything missing in the title? What are the essential elements? Can you identify from this title? Are there any avoidable elements or something which the title fails to convey to you and you actually have to read up the whole thing to understand? I actually can't see the chat box simultaneously. Dr. Amir?
Yes.
I can't see the chat. I don't know.
Okay, one student has mentioned interrogative. That's all.
Yes. Yes, okay. And now I have moved on to, okay, right. This is an important point which you have mentioned, an interrogative title, again, which we have been saying, it raises a lot of sensation as if you're going to answer a huge question. And generally one study is not capable of answering a big question. So this title is concise, it is specific, but the intervention is missing and the comparator is missing. And the interrogative thing, the question mark, which is highlighted in red in this particular case, is the one which would be, if it would have been replaced by a colon, would have been the best thing to do. And again, it's not just the question mark, I would also avoid the word which. So factors predicting incident pressure ulcers in hospitalized patients, a prospective cohort study, or we can even remove the word and just replace it with a colon saying prospective cohort study. So another study is blood pressure and incidence of 12 cardiovascular diseases, lifetime risk, healthy years lost, and age-specific associations in 1.25 million people. So what is as you can see, the study is published in Lancet. What is the first impression that you get out of this kind of a title? Not able to open the chat box. I'm so sorry. I can see some messages are coming, but somehow I'm not able to open.
No, there are no messages in this.
Okay. Okay, I just saw an orange dot, but there is no this thing. So blood pressure and incidence of 12 cardiovascular diseases. This particular title uses the colon very appropriately because it divides, it is kind of combining two sentences into one. So we would give marks for that. But then this is too long a title, too long. And by the time I reached the end at 1.25 million people, I'm hardly able to recollect what I read in the pre-colon part of the title. So this title needs to be made more concise. And the missing element here is the study design. How the authors have reached the level where they could formulate the study. What study design did they formulate to reach this particular kind of conclusion or study this particular kind of a problem? Then the cardiovascular diseases is a subset in which the geographical details may be pertinent. So that would have been a desirable thing to know in this particular kind of a study. And the use of scientific terminology, because this title will be good for a newspaper article, not for a scientific journal article where we could talk more in terms of hypertension rather than just blood pressure or increased blood pressure. Then the comparative efficacy and safety of azathioprine versus methotrexate as steroid-sparing agents in the treatment of airborne contact dermatitis. Again, this is a study in which if somebody wants to like unmute themselves and point out the unnecessary elements or how they would want to better frame the title, it would be useful. Because we have around 5 minutes left, we could do this exercise if possible. Nothing in the chat box. Dr. Mehak, Dr. Monica, Dr. Pooja, if somebody could just let me know their thoughts about this title. Does it appear perfect? See, it specifies, it gives you patient, the condition that it is going to work upon, airborne contact dermatitis. It tells you the comparison is between azathioprine and methotrexate. It tells you the outcome. We are looking for a steroid sparing agent in these patients. The intervention is clear. But then, is this title perfect or not so perfect or needs improvement?
One student has mentioned not perfect, Sumit Kumar.
Sumit Kumarji, if you could unmute yourself and let us know, or write in the chat box. Which is chat box, I mean, it's not opening. I can just see an orange dot, and beyond that, it doesn't open for me.
Good afternoon, ma'am.
Good afternoon.
Type of study is not mentioned.
Yes, good. And anything else?
And ma'am, geographical location is also not mentioned.
Right. So geographical location, when we are looking for a steroid sparing agent, may not be that important because drugs remain the same unless we are looking at any particular enzyme deficiency in a particular population which is pertinent for azathioprine, because the disease tends to remain the same. But yes, you very rightly pointed out the type of study, the design is not mentioned, and this is a longer title, so it has reached the upper limit of 20 words. So there is nothing hard and fast again about the upper limit or the lower limit of the title. The gist is, the idea is that these green colored essential elements should be there, and we should put in all the 4 green color elements as far as possible. We should avoid the red colored elements because they are easily avoidable. So things like the comparative versus in the treatment of, that could be, these could be minimized simply if we put a colon somewhere in between. So that is a way of reforming the title. If somebody wants to, Dr. Sumit, if you want to suggest an alternative title with the broad understanding of, let's say it's a randomized controlled trial, or we could have any other volunteer. If you want to reframe the title, because just by trying to reframe things which are already published, you will be able to do the same to your title when you start working on it. So no attempts at reframing. So another one is assessment of second line antiretroviral regimens for HIV therapy in Africa. So somebody could tell me this, the good or bad elements in this title. See, it's very concise, very short. And by the time I reached Africa, I was clear about, I had retained a memory of what was the initial part of the title. So we are assessing the second line antiretroviral regimes for HIV. But the title doesn't tell us whom we are assessing on. Population is not clear. So only the geographic part is given. So we don't know whether we are testing it on resistant patients or on treatment naive patients, or we are testing it in males or in females. We don't know that. Then the intervention, it's a second line antiretroviral regimen, not much details provided. Comparison with what? We don't know. If we are going to assess it, is as compared to first line regimes, we don't know that. We don't know that from the title, and why would we do that? And the outcome is also not known. The study design is not clear. The setting is given as Africa. It could be further quantified as rural Africa or Western Africa. So these are the things which I would like to know from the title. If we just go by SPICE, the setting, the population intervention, the comparator or the control, the endpoint, what we are expecting, and the study design. So it could be a randomized control trial if I know what I'm comparing it against, or if it is just retrospective analysis that needs to be told that patients who are put on second line antiretroviral regimens after a period of 6 months, their viral counts were this much. So it would be a retrospective analysis. I don't get any idea of what is being done in this study from this title. For all you know, this could be a title for a review article, not a research article. Then the last example we'll do today is childhood onset psoriasis, association with future cardiovascular and metabolic comorbidities. So this, if anybody wants to comment on this. Any comments on this particular title? No, none. So we know the population here is children with psoriasis, I mean childhood onset disease which is present. And what are we trying to look at? The outcomes are future cardiovascular and metabolic comorbidities. But it is not clear to me that whether this is a longitudinal follow-up study, it's a case control model, or what kind of study is this? It could be a retrospective analysis as well. So the missing elements are here. Here are the intervention, the comparison. What is it being compared against? Is it being compared against adult onset psoriasis or adults with psoriasis? We don't know. The study design is not at all clear. The setting is not clear. The time frame is not clear. The nature of study is just not clear from this particular title. So because of that, the title conveys much less than what it hides, what it doesn't convey. And with a excellent choice of words, we can always convey as much information from the title because that is what interests the readers. So just to revise, the last slide which I'll leave you people with is the essential elements, desirable elements, and avoidable elements in the title. So title should be spiced, and you should basically leave out the unnecessary words, declarative, interrogative, and abbreviations. You should make it concise, specific, include the study design, and the essential elements which should be present in any comprehensive title are these 4 PICO elements. So these 4 elements are the ones which are present in your review of literature. They are present in your methodology. They are present in your further work, and they should be essentially present in your title as well. Thank you so much for your attention. I hope this brief session helped in some way. Now I can see the interrogative, not perfect. It is not clear what we are assessing. Study design not mentioned, study setting not mentioned, and location and type of study. So thank you, Dr. Ramnik, Dr. Pooja, for these comments. And I close this session. In case there are any questions, please let me know.
Thank you, Dr. Chander, for this short and succinct session on how to write the title. The important points have been covered in this. I just want to convey, as I had conveyed on the first day also to all the PG students, that what we are saying here are guidelines. Don't think that all these are in black and white. Like if the study design is not mentioned, then that study title is not valid or not okay. It's not like that, that in every study title, in every thesis title, you must have study design in that, you must have the location in that. It's not like that. It will depend, as ma'am also mentioned, it will depend upon the context, whether it is relevant to that particular title to give it more clarity or not. If the title is clear without that, then also that title will be okay. So these are some general guidelines. Please keep in mind these things. It will help you to improve your title. Thank you, ma'am.